How's it going, everybody? This is Nathan with Healthy Legs. Today I have Dr. David Draughn. How's it going, doctor?
Just fine. How are you, Nathan?
I'm very good. Thank you for joining me. Dr. Draughn is from Vein Specialists of the Carolinas. Their slogan is all we do is veins all day, every day, which I love. So yeah, thanks so much for joining me. Quick question, how long have you been in vascular restoration for?
Well, I've been in general surgery for 25 years, and
Wow.
much of that deals with the vascular system. It's mostly arterial. So I did very little vein work up until I changed into veins exclusively, which was in 2006. So about 13 years I've been doing exclusively vein surgery. No arteries, just veins.
Okay. And why the switch? What made you want to do that full time?
Well, it's interesting. My wife had pain in her legs, and she has arthritis in her knees, and the orthopedic doctors and everybody told her it was her knees that was causing the pain. And she said, I don't really think it's that deep of a bone type pain. It's more surface level where these veins are. But the veins that she was referring to were not varicose veins. They weren't spider veins. She didn't have phlebitis. She didn't have swelling. She didn't have any of the physical findings that are typical of varicose vein problems. But she said, I think it's these veins. And I said, well, I don't think it is. Of course, I'm a doctor. She's a nurse, so she's usually always right. Um, she went to a vein specialist, and he did a study where you stand up and you do an ultrasound of the veins when you're standing. And that measures the function of the valves, the one-way valves that keep the blood moving upward against gravity toward the heart.
Sure.
When those valves go bad, you develop reflux or reversed flow. And that reverse flow can cause all kinds of just generic symptoms: achy, heavy, tired, throbbing, itching, cramping, all these kind of vague symptoms that nobody really understands. And so she had that ultrasound, and it showed reflux in several large veins on both legs. And at that point, I realized that, I'm a board certified, university trained surgeon. How could I have missed this? And
Wow.
if I've
Yeah.
been missing it, then so has everybody else. And so that just kind of opened my eyes, and I started doing more and more vein patients, and pretty soon got so busy that I didn't need to take call and didn't need to work for, go to the emergency room. And I just dropped all the other stuff and did veins only.
Wow. Yeah. It seems like it's, more and more recently, discovering more and more about veins and how much, what types of symptoms basically are, being caused by having bad veins. And then as well as, in the past, what was it, about 15 years ago, the vein procedures were much more invasive, used to, strip out basically the entire vein. Why
Right.
don't we talk, yeah, why don't we talk about some of the procedures and what that looks like now, compared to 15 years ago?
Right. In the old days, the only really test we had to test the veins was a venogram. And you would put dye in the top of the veins near the groin, and you would let it flow downhill to see if there were broken valves. Well, that test was invasive. It required needles and dye and all that stuff. And then if any of the valves were good, then the dye wouldn't flow downstream, and you'd get a falsely, normal test. So they started with the ultrasound to look for blood clots, and that evolved into being able to study the valve functions. And so the standing ultrasound to look for reflux or broken valves is what has really revolutionized vein care. And then instead of doing vein stripping in the operating room, they evolved into putting a catheter inside the vein and using ultrasound to guide it. So instead of having to cut the skin to find the vein, now you can see through the skin with the ultrasound. So we put a catheter in the vein, and we numb up the vein, and then we heat it, and that cautery burns the vein enough to seal it permanently off. And so that was the first real revolution in vein care, and that was about 15 to 20 years ago. And now it's evolved from heating the vein. Now we have devices that go in there that don't use heat, but they close the vein without heat. One uses a chemical foam, one uses a mechanical device that just traumatizes the lining and you mix a chemical with it. Another one uses glue, like a super glue type material. So there's all kinds of new techniques out that are being used. But the other revelation in vein care is only about 10 years old. And that's where, instead of just studying veins of the legs, from the groin down, we realize that the veins go from the groin all the way up to the heart. And they join together in the pelvis, and the veins can get compressed by the arteries which cross over the top of them. And being able to identify that on an ultrasound is the new revolution. And the ultrasound that we use is an internal ultrasound. We actually put an ultrasound probe inside the vein. It's called IVUS, or intravenous ultrasound. Mm-hmm. So now when people have leg symptoms and treated all the varicose veins and all the reflux in the legs, if they're still having a problem, you look upstream and you look for these areas of venous compression. So IVUS is the second revolution. So the first revolution was finding the reflux with the standing up ultrasound and treating it non-invasive or minimally invasively. And now we can find this venous compression, and then we can treat it minimally invasively with stents, like they do in the hearts and in the heart arteries and the other arteries. So this is the second wave of revolution in vein care. So much so that the field of vein care is really going to become its own specialty. That process is in the works now, and it'll be called the current society. The boards that you pass, the tests that you pass, are offered by the American Board of Venous and Lymphatic Medicine. So there'll be a field called venous and lymphatic medicine, which is totally separate from vascular surgery, which is always focused 90% on arterial surgery. And so most vascular surgeons do nearly all vascular surgery. Some are now starting to do some venous surgery, but forever they ignored the venous field and didn't want anything to do with it. Until now, there's revolutionary, successful surgical treatments. Now they want to claim it again. So it's going to be some, gnashing of teeth in the future as to where this field ends up, whether it's part of vascular surgery or its own separate field.
Yeah.
Yet to be determined.
Very interesting. So then what types of symptoms or ailments are most patients experiencing when they come and see you?
Well, I like to refer to vein symptoms as the common cold of leg pain. So when you go to a doctor with leg pain, first he's going to look for a blood clot in a deep vein with an ultrasound, but that ultrasound will be done lying down. And then if that's negative, then they're going to think about a blocked artery, where you have pain in your calves when you walk. And then they're going to think about maybe arthritis in your knees or your hips, maybe a herniated disc in your back, maybe a nerve conduction study. So, but vein symptoms kind of cover a little bit of everything. It starts with heaviness, aching, tired, weary. Some people say throbbing. Other people have restlessness. It's very common to get a heavy, achy, swollen feeling leg. And then when you lay down and prop it up, it switches over to a restlessness and cramping. So nighttime cramping is a very common thing that most doctors don't know can be a vein symptom. Restlessness is a very common symptom that if you tell a regular doctor you have restlessness in your legs, they're going to say, oh, you have restless leg syndrome. Well, the huge percentage of patients that I see with restless symptoms of their veins, those all go away when you fix their vein problems. So the vein symptoms are just kind of vague and non-specific, but the one common element that kind of separates them is that people with vein problems or pain in their legs, when they prop their legs up, their legs usually feel better. And it's the ability of the vein to then drain by gravity that makes it feel better. So the pathology with veins is that they don't empty properly. And the veins aren't carrying the pretty red oxygen-rich blood with all the nice new nutrients. The veins are carrying the used blood that has come from cellular metabolism and is carrying carbon dioxide and lactic acid and urea and ammonia and waste products. So your veins are your sewer system. And if your sewer system's not emptying, you're not going to be a happy camper. And so the symptoms are kind of vague. You're not, not like a herniated disc has a lightning bolt shooting down the back of the middle of your leg, and everybody knows that as sciatica. Arthritis is when it's cold, it hurts. When you don't move your joints and you start moving them, they hurt, but after you move them, they get better. These patterns are real common, but vein symptoms can be numbness, tingling, itching, stinging, burning, aching, heavy. They're kind of vague, but elevating the legs is usually the key that makes them, you can tell that if it feels better to prop your legs up, that's usually the patients with vein problems are always looking to prop their legs up, seems like.
Sure. Yeah, I had both of my parents actually having vein issues, and especially with my mom dealing with it for 10, 15 years before finally, figuring that out. Kind of a similar situation to your wife, and that's how I ended up, being so interested in this and wanting to help spread the word. And how many doctors do your patients typically see before coming to you, but with being undiagnosed?
I don't really know. It's a good question. A lot of patients will have been to an orthopedist. They'll been to, will have been to a neurologist. They'll been maybe some even to a vascular surgeon who will look at their arteries and say it's not their arteries. But
Sure.
People are getting more and more educated now with the internet and all the available resources for people to educate themselves.
Sure.
Most people come in with, I don't have many people that come in with another diagnosis. I mean, I find blocked arteries every now and then. I find a herniated disc every now and then. I find somebody with really bad hip arthritis or knee arthritis. And we find these other things where the patient thought it was their veins because they have veins, but the real source of the pain was something else. So we refer those patients out. But, most people are pretty good at, patients are almost better at picking it up than the doctors.
Yeah, for sure. They're the ones that know exactly how they feel, and they're the ones, Googling symptoms, and like you said, a lot more information out there these days, which is really good. So, very good. So another question I had, what do you think is the biggest hurdle or struggle that people face when, really trying to choose a good surgeon for this procedure or for one of their procedures?
I think there's a couple of hurdles. One is that people have been given the impression, probably from the medical field, that veins are cosmetic and they're not a medical problem. And insurance companies have a lot of criterion that they set to make it be defined as medically necessary so that they can pay for it. They don't want to pay for it. They want to set a criterion such that everything gets determined to be not medically necessary. So physicians have been kind of brainwashed that when patients get sent for treatment of their varicose veins, it turns out to be not medically necessary by the insurance criteria. So then they get the word that it's cosmetic, and it wasn't. Their patient comes back and tells them it's not covered, and so that misconception gets carried forward. But in reality, if you ask the patient the right questions, they're going to give you the right answers that are going to meet all those conditions for medical necessity. So the first hurdle is getting that misconception that varicose veins are not a medical problem, and swollen leg is not a medical problem, and venous leg ulcers. These are all serious medical problems of varying degrees. But the whole process of a dysfunctioning venous system is a medical issue. Whether it causes a clinical problem that's so bad you need it to be fixed, that's kind of a different story. Some people have terrible varicose veins and they don't really care. Their legs don't hurt and don't swell, and they don't care how they look.
Yep.
Other people have barely any varicose veins at all, and they have a big old huge venous leg ulcer down there. So the first hurdle is getting over that misconception of that it's not really a significant medical problem.
Sure.
And then the second thing is there are a lot of people that dabble in vein care. Lots of practices will do some injection of spider veins. You got plastic surgeons and dermatologists doing injections of spider veins. And some of those doctors go on to do a little bit more vein work. So the vast majority of doctors that treat the venous system only treat the superficial venous system, which is underneath the skin, but it's outside of the muscle level. And so lots and lots of doctors treat that. very few people treat the superficial and the deep venous system. The deep venous system is the critical system, and it's forever almost been off limits, because if you mess it up, then you can't drain the limb of its waste products. But now we have really started into that territory and have a lot of success at it. So I treat the superficial and the deep venous system. And a lot of people that come in will have both, but they'll go to a vein doctor. That doctor will treat the superficial system and say, well, I can't help you anymore, and won't bother to look into the deep system as a second problem. So a lot of people get treatment, their veins come back and they don't know why. They think the doctor did a bad job. Well, it may be because you had a second problem that didn't get looked for. So that the awareness to look for that and think about that is really coming about now that we have IVUS, intravenous ultrasound, to look for those things. So,
Yeah.
so if you go to a vein specialist, that's fine, but you know, that deep system also needs to be considered, and some do and some don't. And you can probably tell by looking at their website whether they, you know, do that or not. And
Yeah. What is that?
most of the time you treat the superficial system first anyway. So that's okay. You can go to those doctors.
Sure.
If they don't get better, or they don't, or there's something's not getting the result you want, then there may be something else going on.
Okay. Yeah. When you are doing the research and you know, looking at other websites and whatnot, what a key, is there any certifications, or specifically you're looking for specifically surgeons
A
or?
lot. Yeah. No, you don't have to be. That's what's really neat about the vein world right now, is that it's, when you go to the national meetings, there's ER doctors, there's cardiothoracic surgeons, there's radiologists, there's dermatologists, there's general surgeons, vascular surgeons, and everybody that has taken an interest and wanted to become a specialist and taken it upon themselves and their own initiative to learn this.
Yep.
In the meetings, you're learning from all these other specialties. You're not marching in a little line like a little toy soldier, just following the dogma of your niche.
Mm-hmm.
It's really interesting to be able to have all those points of view.
Totally.
In the future, in order for us to be a recognized specialty, we will have to have a fellowship, which is sort of that indoctrinating dogma training, and that hasn't really developed yet, but it's coming. But what was your, I'm sorry, I lost track. What was your?
Yeah, just what are the biggest credentials that someone can look for?
So there's a lot of those credentials. A vascular laboratory where the ultrasound is done needs to have IAC accreditation. And that stands for the Intersocietal Association or Accreditation Association or something like that. It's IAC accreditation, and that means that the ultrasonographers that are doing your studies are registered vascular technicians, and they have specialty training in vascular ultrasound. So that's important, to have an IAC accredited vascular lab and to have RVTs doing your studies. The physician that interprets that needs to be an RPVI, registered physician in vascular interpretation. You would like for the doctor to be a member of the American Board of Venous and Lymphatic Medicine, ABBLM. So that's a lot of doctors that just dabble in this won't go to the trouble to sit for those board tests and do the criteria that are required to get board certified. So there's another, in my particular office, where we take care of the deep vein problems with the stenting, we are accredited by the AAAHC, which is similar to JACO for hospitals. And very, very few, matter of fact, I think I am the only exclusive vein practice with AAAHC accreditation that does deep and superficial vein work in the office. There are some AAAHC accredited vein specialists that do superficial. There are some vascular surgeons and radiologists that do other arterial and other procedures in addition to veins in an accredited facility. But I think we're the only, as far as I can tell from looking through the registries, the only exclusive vein practice that is AAAHC accredited doing superficial and deep vein work in an office-based setting.
Sure.
So,
Very interesting.
but if you don't have those, it doesn't mean you're not a good doctor and you're not going to
Sure.
take care of your patient. It's just doctors and technicians that have gone to that extra effort are willing to demonstrate to the public that they're dedicated to it.
Sure. Yeah, it just helps as a potential patient just to understand before going in there. So yeah, that's really helpful. Definitely useful to know what to look for basically. So that's pretty much all the questions I have. Do you have anything else that you want to add? Any last minute advice for anyone that's looking or that's having vein issues?
Well, the main thing that I think is to know is what my little phrase that I use, that vein problems are the common cold of leg pain. So if you're having leg pain, you don't just need to think of a blocked artery, a herniated disc, and arthritis in a knee joint or something like that. If you have swelling of your legs, color changes of the lower legs where they get kind of that brown coffee stain look on the lower legs, if that develops into an ulcer or an injury that won't heal, there's a lot of, and now with these pelvic deep vein problems, pelvic pain is also part of the picture. So, the achy, heavy, tired, tingly, numb, stinging, they're kind of vague. They don't really point to a specific thing. But if you're
Sure.
having that and your legs feel better when you prop them up, you've probably got a vein issue.
Okay.
50% of women by age 50 have vein related issues and 30% of men. So it's
Wow.
extremely common.
Extremely common. Yeah.
Extremely
Yeah.
common.
And not nearly enough treatment centers out there. So that's, yeah, it's great that you guys are doing this work. And if anybody wants to come in for a vein screening, they can go to veinscarolina.com and come in and see you. And yeah, thank you so much for your time today. It's been a pleasure.
Thank you.